Well, joining us live on this broadcast is Dr. Jerome Kim, the Director General of the International Vaccine Institute. Doctor, good to see you. Maybe I can start by asking you, WHO says they do not know where the virus came from or came to the humans or affected humans, but they have ruled out the lab leak theory. Do you support that conclusion? And how important is it for us to know the source of this pandemic to prevent future ones?
So I think that in the short term, in the midterm, knowing is kind of irrelevant because we know what we need to do. Right now, we have to vaccinate as much of the world as possible, as quickly as possible. In the long run, understanding transmission from animals to humans is very important. We've seen many diseases that have made the jump from animals to humans. And since the human population is what we call naive, it has never seen many of these viruses before, the potential for spread in human populations is significant. We've known about the coronaviruses for a while. There was SARS-1 in the early 2000s. There was the Middle East respiratory syndrome, which we've known about or have called a syndrome since 2012. And now we have SARS-CoV-2 or COVID-19. There are other classes of viruses that exist in animals and can transition to humans, the paramyxoviruses, the influenza viruses, which have been a source of constant epidemic and pandemic incursions over the history of mankind, are known to be pathogens that could become pandemic. So we have to be ready for those. We need a system that will pick them up, that will notify authorities, a system to do sequencing so that we know and can publish those rapidly so vaccine manufacturers will have access to the tools that they need in order to come up with new vaccines. Now, the question has arisen, did this occur not necessarily by malicious intent, but as a leakage from a government research institute, or did it occur because of research that scientists often do on what kinds of mutations exist in viruses that make them stronger or better or faster or worse in terms of their ability to cause human disease? Some countries around the world have decided that they will no longer officially support that kind of research. But does that prevent other countries or groups from working on it? No, it doesn't. But I think that having a set of restrictions and very careful kinds of guidance over the level of biosafety that is necessary in order to work on these kinds of viral mutations is going to be very important and something that we really do need to think about as we design the next set of rules for use in laboratories around the world. But I think your point is a good one. At this point, the vast majority of information points to, bats or transmission from bats to another animal, then to humans. Can we rule out that there was a laboratory issue at hand? No, at this point we can't. But really, the task in front of us to control this pandemic is vaccination. And manufacturing enough vaccine, distributing it around the world, and then using it successfully in campaigns.
Let's talk about the importance of this vaccine. Will vaccine patent waiver help in, boosting global production? Proposal by India and South Africa has now been backed by the United States and the WHO.
So I think it's really important first to realize when we need the vaccine, and we need the vaccines now. And we need them for the next six months or so until vaccine production has been scaled up around the world. The question then becomes, will the waiver of patents, even if it were possible to get it through the WHO over the objection of several major European countries and vaccine manufacturers themselves, would it be possible to make up the difference in that 6-month period? And the answer, unfortunately, is no. The patents themselves are not the thing. There are 50,000 steps in the manufacture of the BioNTech RNA vaccine. Without those 50,000 steps, you won't be able to execute the patent. You won't be able to complete the product. What's very important, and remember that IVI is an organization that very, very strongly believes in transfer of technology to qualified manufacturers around the world. I mean, we've done it. We've worked with Indian companies and a company in Bangladesh. We're happy to do that. We haven't taken a patent out on any of the vaccines. But it's really important that the vaccines, when they're transferred, be transferred with all the information necessary in order to make the vaccine as quickly as possible, with as high a quality as possible, ideally so that it will pass a WHO required review and be acceptable in that sense. So I don't think that we'll be able to do it in the time needed to really, where the vaccines will really have an impact, which is the current shortfall. Now, should we do something that will allow us to respond better next year? Yes, so we should definitely begin to work on this question. And if other countries will support it, and if this is a measure that will gain enough support at the WTO to be put into some form that is practical, I think we should work on it. But let's not lose sight of the fact that we need, as quickly as possible, to work with those people who've made vaccines before, who've made World Health Organization approved vaccines before, to work with the major companies and to just increase production as quickly as possible now. Now, the other part of this is, you can manufacture a vaccine within your own country, but unless the vaccine manufacturer has a corresponding regulatory authority, in India it's called the DCGI. DCGI is deemed functional by the WHO, which means that it has all the capabilities to be able to regulate vaccines safely and at high quality. Not all countries have that. And I'm not sure that you'd want a vaccine manufactured in a country with a very small population that isn't going to be able to be reviewed for quality and safety, and where that country will not be able to export vaccines to the rest of the world. So again, as you're thinking about the big picture and the tremendous demands, it really is going to fall on the companies that have done this before. And as much as possible, we're going to have to depend in the next 6 months on really, really pushing the companies to manufacture more vaccine.
Dr. Jerome Kim, thank you very much for talking to WION.